What does the rehab, the recovery, and the return to sports after an ACL injury actually involve? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform at your best. Now, we've talked so much in this injuries and surgeries series so far about all different factors and all different features of ACL injuries. What they are, why they're a big deal, how you tear them. Do you need surgery? How can you avoid surgery? What does surgery entail? What the graft options are? What do you do in kids? The last thing I want to address is how you get over these surgeries. We talked about why it's such a big deal, to try to get back to sports and exercise, but how likely is that and how hard is it? Well, we talked about how this is an outpatient surgery. You come in one morning, go home the same day. I tell patients sometimes that my part of this is about 60 to 90 minutes of time in terms of the actual surgery time. But your part of this is very long. It's 6 to 12 months, a lot of times, hard work to get back to the way you were before surgery. Certainly to get back to whatever it is your sport or exercise is. So early on, some surgeons will put the patient in a brace, some don't, but that's not at all uncommon. And you may be on crutches for a period of time while your knee's kind of recovering. But gradually you start getting your ability to walk back. You also work very, very early on getting your knee motion back. You're working on getting it all the way flat and starting to bend it as much as you can. It can take 6 weeks sometimes to get all of your knee motion back. That can be really hard. You want to get your full extension, your knee all the way straight as soon as you possibly can, because that can be really hard after the first few weeks with surgery. And then you want to start working on getting your knee quad strength back. So they may have you start doing your straight leg raises, lifting your leg off the couch or off your bed, trying to do that, even just be able to do it at all in the first few days after surgery. Then you're going to start doing it more and more. Then you're going to start really early on. You're going to start working with a physical therapist. I usually have patients after an ACL surgery start to work with a physical therapist 4 or 5 days after surgery. Again, getting your motion back, getting your strength back. And there's a lot of work, but doing it with a physical therapist is, I would argue, much better than trying to do it on your own. I think this would be a very, very difficult injury to get back to normal, or at least get back to the way you were before, or get back to where the knee feels like the other knee without physical therapy. But that process goes on for a long time. We start advancing strengthening with squats and leg presses pretty quickly. Usually around 12 weeks or so, you get to start jogging. That's not a hard and fast rule. It depends on how you met some of the other milestones, but we don't typically like it much earlier than about 12 weeks because of the concern of that repetitive stress on the graft, the tissue that's going to become a new ACL. Then you start working through functional drills, agility drills. You may be jumping around a ladder, sort of looks like a game of hopscotch. You may start to balance on that knee and just that leg. You may start to do some landing and pushing off, again under the guidance of a physical therapist. They may do some strength tests around 4.5 months to see if your surgery knee is as strong as your uninvolved knee, and that can help gauge return to sports. And then when all that's going well, the therapist may start with you some sport-specific drills. So if you play soccer, they may have you kick a soccer ball with one leg while you balance on the surgical leg. They may start teaching you how to land on it. So if you play basketball, or you're a wide receiver in football, or something where it involves a lot of jumps and landing from jumps, that you get ready for that. They'll try to recreate what you need to be able to do to minimize your chance of re-injury. But generally, that return to sports process is in the 6 to 12 month range. We think that generally about 2/3 of athletes get back to playing at the same level they were before they suffered the injury at 12 months. That surprises a lot of people because they assume just because I had surgery, I'm automatically guaranteed to be back. But unfortunately, it doesn't always work like that. There's fear of re-injury. There's obviously people that struggle with getting their motion and strength back, or it just doesn't feel right. There's a lot of reasons people don't get back to the way they were before. But I think if the surgery goes well, you work really hard on the rehab with a physical therapist, you have every chance to getting back to the way you were before you hurt your knee. Okay, have you suffered an ACL injury, and what was the rehab like for you? I would love to hear how physical therapy went and the return to sports phase went for you. So below this video, share your experience so that people all around the world, including me, can read how it went for you and we can all learn from each other. If you know somebody dealing with an ACL tear, maybe they're preparing for surgery, maybe they're in the rehab phase and return to sports phase after that ACL surgery now, please share this video with them. I really want to help as many people as possible, so if you know somebody dealing with this injury, definitely share this video. If you like videos like this and you want more information on sports and exercise injuries and surgeries, subscribe to my YouTube channel. I record a couple of these videos every single week and they'll get delivered directly to you. Just click on the subscribe button in the upper right corner of the page. Thank you so much for watching. I really appreciate it. I hope it was helpful, and I look forward to seeing you right here next time.